Very warm welcome to this session, Evaluation in the Time of COVID-19. My name is John Mitchell and I'm currently working as a part-time capacity as a special advisor to ALNAP, helping to pilot a new leadership structure with Juliet Parker, our acting director. Some of you will remember me from my previous director role, which I had been in for many years. And I'm delighted to still have a relationship with ALNAP and be involved in so much exciting work. This ALNAP meeting is all about learning from the changes, both positive and negative, brought about by pandemic-related disruptions. It's particularly relevant for the evaluation community who have always been called upon in times of major crisis to play a lead role on learning and improvements. We've only to look back at the initiatives created to improve learning and accountability by the joint evaluation of emergency assistance to Rwanda, as well as the influence of the Tsunami Evaluation Coalition on Jan Egeland's humanitarian reforms. More recently, we have seen how the evaluative response to the Haiti earthquake helped shape the World Humanitarian Summit agenda and reforms around localization. Now, the majority of these changes came about as a result of the findings and recommendations from ex-post evaluations. But in the case of the COVID pandemic, we're seeing something very different, notably changes and modifications in the practice of evaluation itself, particularly around the use of real-time evaluations. Now, the RTE story began in what became known as the evaluation boom in the late 1990s and 2000s, when more and more agencies increased their capacity to conduct independent evaluations. Now, this boom also created a desire to evaluate the evaluation, so to speak, to check that increased resources were being used wisely. The concern was that evaluations did not become too self-referential, remote, and disconnected from those people directly affected by crisis situations. So RTE seems like a natural corrective to the overemphasis on ex-post evaluations and the rather dry institutional approach they generated. And with a lightness of touch, short timeframes, and ability to get close to operations, they were seen as facilitatory rather than judgmental. Their hybrid nature could bridge the gap between evaluation and monitoring. And most of all, they were seen as being able to address the humanitarian imperative by gearing themselves to helping people rather than improving the system. Now, you remember that they were championed initially by UNHCR, who for several years were the chief proponents of RTEs. And it didn't take long before they were adopted by many more frontline NGOs who related strongly to the immediate desire to save more lives. And in essence, we saw a mini RTE boom. And in 2009, ALNAP published the first guide to conducting RTEs. And this has been a popular product down the years. Now, I do believe that many RTEs were both popular and effective, and I also heard criticisms about inconsistent methodologies and an absence of theoretical underpinnings. Now, I'm not sure how deep these criticisms go, but whatever the case, it would appear that RTEs have had a renaissance in the time of COVID, and I'm very keen to hear more from our speakers who have undertaken RTEs and other forms of real-time learning during COVID. Now, in a moment, I'm going to hand over to Susanna Morrison-Metois, Senior Research Fellow for Evaluation and Learning here in ALNAP. And Susanna's will be introducing our recent work and newest publication on the use of real-time learning exercises during COVID. And we'll then transition to a panel discussion with UNICEF, UNFPA, and Margie Buchanan-Smith. And we'll finish with some closing remarks by UNFPA's Director of Evaluation. So I do hope you enjoy the session, and over to you, Susanna.
Great, thank you, John. So before we start, I just want to go through a few points of digital housekeeping. So hopefully you have joined us through ALNAP's platform. Now, I just want to point out that we'll have two ways that you can interact with us, with the panelists and the speakers today in this session. So if you go on the platform and you go into the upper right-hand corner, you're going to see an icon that says polls. So if you click on polls, below that you will see a Q&A option. So if you want to go and test that out right now, upper right-hand corner, click on the polls icon, and then it'll open up the Q&A. So while we're speaking, during the presentation and during the panel, please feel free to ask your questions here. And you can also click to vote, to upvote questions that you would like us to answer. The other way that you will be able to interact with us and with the other audience members is through the chat function. So in order to access the chat function, it's also in the upper right-hand corner. Finally, if you're watching this in the platform, one thing that you might want to do for better viewing quality is to click on the upper right-hand corner where it says View, and you can maximize the view. That way you can see both the slides and the speakers. So those are just a few points of digital housekeeping. So now we're going to go into the presentation of the paper. Next slide, please, Maria. So I have the privilege today to present ALNAP's newest paper. So we're just launching it now. It's coming out, so you will see actually in the chat function also the link. So this is a paper essentially that is looking at the move from real-time evaluations to real-time learning during COVID-19. So I'll be introducing the paper and the background of it, and then I'll be handing over to the lead author of the paper, Margie Buchanan-Smith. So I just want to take a moment first to introduce Margie. So Margie has over 30 years of experience in the humanitarian sector as an evaluator, as a trainer, and as a coach. She's had a long-term relationship with ALNAP and ODI over the years, and she also co-authored ALNAP's 2016 Evaluation of Humanitarian Action Guide, which has also proven to be very popular. So I just want to go into a little bit of the background for the paper. Next slide, please, Maria. So essentially, what we've been doing at ALNAP over the last year is we've been looking quite in depth, I suppose, at how COVID has been a disruption and what has emerged out of COVID in terms of the impact that it's had on evaluation and M&E practices. So I think that there's been kind of this renewed emphasis and a demand for learning. And one of the ways that we've been trying to listen actually to our members is by having a series of peer-to-peer learning workshops. So we held 3 workshops earlier this year where we brought ALNAP M&E staff together to share their challenges, their solutions, and their adaptations to M&E that they've been making during COVID-19. So as part of this, we also produced 3 background papers, so focused on different aspects of how M&E has been forced to adapt due to the disruption of COVID-19. So we had one paper which looked at the remote digital M&E. So this focused on ethics, challenges, and gaps in remote M&E, but also suggestions on how to best overcome these. We had a second paper which looked at the historical development of evaluation in the humanitarian sector, but also how the disruption of COVID is likely to impact the future of evaluation practice going forward. And finally, we had a paper on how evaluation functions, strategy, and evaluation planning have had to be adapted during COVID-19. So both in the key informant interviews and in the workshops, what we were hearing from many ALNAP members and organizations was that there was this renewed focus on real-time evaluations. But not only real-time evaluations, we were also hearing about real-time assessments, real-time reviews, and a variety of other forms of rapid learning reviews. So oftentimes it seemed that the evaluation functions were being tasked with producing these rapid learning reviews with very short timeframes to feed back into the ongoing COVID response. Next slide, please. Oh, I guess we're there. So as you just heard from John, there's been a history of RTEs in the humanitarian sector. So ALNAP has been a leader in the past in promoting RTEs and produced one of the first guidances on RTEs in 2009. And as John mentioned, RTEs have they've come in and out of fashion over the years. And I think that what we saw during COVID is that the pendulum has swung back to RTEs, but also to this much wider variety of real-time learning exercises. But what we noticed actually is that many of these real-time learning exercises during COVID were drastically different than the RTEs and the real-time evaluations that are written about in ALNAP's original guidance. So people were doing something new, more creative, and more interesting. So we really wanted to do a paper that looked at some of these creative approaches, and we wanted to try to capture what different organizations were doing better. Hence, we decided to have a specific paper on real-time learning during COVID-19 to capture these experiences. So I think you can see on the slide that we reached out to a number of members, so NGOs and UN and IFRC. And so the paper really tries to share how various organizations approach their real-time evaluations, but also their real-time learning. And what it does is it gives specific examples, and it also provides top tips and some advice. But we deliberately didn't want the paper to be too prescriptive. So the original ALNAP RT guidance is very prescriptive. And this one, it's more documenting and showing ideas and showing examples that we think are useful, I think, for others who may be thinking about doing an RTE or a different type of a real-time learning review. Next slide, please. So there's this question of actually, what is real-time learning? So, we've heard a lot about RTEs, and they have a long history in the sector. But real-time learning is actually a new term. So this is a term that we at ALNAP came up with. And so we want to use it to describe a broader range of evaluative approaches that have short feedback loops, that tend to be less formal, that are generally less structured, and much less structured than traditional types of evaluations. So in ALNAP's original evaluation of humanitarian action guide, there was an image that actually shows the spectrum of evaluative exercises. So on the left-hand side, you can see that there's quicker, more informal exercises going to the right to the more formal, structured, traditional evaluations. So for us, real-time learning is a broader category under which there are specific subcategories, and it's kind of the left-hand side really of this spectrum of evaluative exercises that you can see on your screen. Next slide, please. So like I said, real-time learning for us is this broader category, but within that, there are specific subcategories. And so I think Margie is going to go into this and explain a little bit further in her notes. But one of the things that we noticed is that some of these sorts of subcategories are more appropriate early on in the response. So early on in COVID, we saw a lot of after-action reviews, adaptive management reviews, and then we started to see more real-time reviews and real-time assessments, so a little bit less rigorous than the real-time evaluations. And now I think we're starting to see more real-time evaluations, so going a little bit more to the formalized end. So for me personally, I felt that it was really important to have this new term to give a name to the range of exercises that we were seeing. They were very much breaking the mold of traditional evaluation in some fundamental ways, and COVID clearly created a demand for learning and for thinking about learning and evaluation much more outside the box. And so now I'm going to hand over to Margie, who's going to speak a bit further about the real-time learning and the paper. So with that, I'll hand over to Margie.
Great, thank you very much, Susanna. So if we move to the next slide, it starts with this quote, which came from one of the key informants that we interviewed. We have structured ways of doing RTEs, but the global pandemic blew it out of the water. And I think this really points to the fact that the COVID response demanded a very different way of working for many evaluation functions. So from the practitioner side, there was some dissatisfaction with traditional evaluation methods, which were often seen as too institutionalized and inflexible, as John mentioned at the beginning. And so there was some resistance to talk of doing evaluations in the kind of highly pressurized context of the COVID response. And so evaluation managers were looking for lighter and more flexible alternatives to meet practitioners' learning needs. And indeed, some agencies had already dropped the RTE label to use other labels like real-time reviews, which somehow were a little bit less threatening and perhaps came across as being a bit more supportive to practitioners. But the uncharted territory of the pandemic, on the one hand, it challenged agencies in their response and how to adapt their programming, but it also really lent an urgency to learning. So in terms of adaptive management, in terms of learning from innovation, doing things differently. But the global scale of the pandemic was a real challenge, both to the response, but also to designing appropriate learning methods across, well, within organizations, across countries, and indeed across regions. So for evaluation functions, they really had to rethink their roles, and there was an opportunity, indeed a need, to be creative. So it was, in a sense, an invitation to be as utilization focused as possible. And this really required some thinking outside the box. And we think this is where some of the kind of exciting and creative examples came from, was this thinking outside the box. So in this presentation, I'm going to draw on what we can learn from these different experiences, the wave of RTL, real-time learning exercises across the sector, and I'm particularly going to focus on what worked. So if we move to the next slide, which shows, this is just trying to sort of capture what happens in one of these real-time learning exercises. So in many ways, real-time learning is a kind of journey. And I think this slide describes that journey from implicit individual knowledge and experience to really kind of taking that forward to being much more explicit organizational knowledge. And along the journey, that may involve inviting staff to tell their story. It may involve teams coming together to do some collective reflection and learning. And it may involve kind of sense checking and validating the findings at a more organizational level. So that the knowledge and experience that is captured becomes this explicit organizational knowledge. And it's much less about the kind of final output in terms of a lengthy report, but it's much more about the process of going through of this journey. So that the explicit knowledge is actually internalized by staff along the way. So if we move to the next slide, as I mentioned, we've picked out what appeared to be the success factors from the number of different real-time learning exercises that we reviewed. I'm going to run through some of these quite quickly, but we'd be delighted to hear, you know, in the chat and the Q&A from any other examples that people would like to offer. So first of all, in the planning stage, it was a question of seizing learning opportunities. There was a keen interest, there was a real hunger to adapt and learn, particularly in the early months of the pandemic, across country programs, to learn about the quality of programs. And so it was when evaluation functions spotted those moments and grasped them, often having to grasp them very quickly. It didn't often allow a lot of time for planning, but being highly responsive. Second success factor was ensuring wide buy-in. Sometimes that meant at senior management level, sometimes right from the top, from an executive director, for example, which would send a message to the rest of the organization that senior management took the exercise really seriously and really wanted to learn. Of course, that helped with the take-up of findings afterwards. Thirdly, adapting the approach to fit. Now, what do we mean by that? What we mean is by being driven, the approach should be driven by the learning needs of the organization rather than by evaluation protocols. And so I think this is perhaps an area where sometimes we've become overly procedural in our evaluation methods, and these RTL exercises during the pandemic encouraged a very different way of working. So much more light touch, less demanding, more responsive to practitioners' learning needs. And this is where the RTE label also generated some resistance amongst staff when they were under a lot of pressure. And it's like, you know, keep away with your heavy evaluations. We want something much quicker, much lighter, that's really going to help us in our learning and adaptation. Fourthly, there's some really interesting examples of how different agencies broke a large real-time learning exercise into different components. And of course, that was really important for global learning exercises, which could be an extremely daunting task. But different agencies found different ways of making that daunting task manageable. And I just want to highlight 3 different approaches that agencies used. So first of all, carrying out 2 parallel exercises simultaneously. And I'm going to give you an example from War Child Holland. So they commissioned a real-time review to capture the grassroots perspective alongside a second exercise that looked at management and coordination issues from the perspective of agency staff. So they broke it down into these 2 exercises that ran in parallel, but both using the same analytical framework of the core humanitarian standard. Other agencies used more of a kind of layering approach. So UNICEF, World Vision, both used this approach, where a number of different exercises were being carried out, perhaps some at country level, some at regional level, and some at kind of global headquarters level, sometimes again to a common framework. These might be adaptive management reviews. They might be, some of them verged more towards the RTE approach. But again, what was fundamental, what was the key characteristic, was that these different exercises were designed to really meet the needs of the country office or of the regional bureau or indeed of the global headquarters. And then the third approach is what we've called the phased approach. And I'll give an example from DRC, Danish Refugee Council, where their first real-time learning exercise was launched in the very first few months of the pandemic, and that was very focused on how the organization had scaled up and adapted in terms of what had worked and what needed to be changed, much more at a kind of organizational management level. And that then informed the second phase, which was a deep dive in 4 countries, looking very specifically at the balance of duty of care versus stay and deliver. Then moving on to the next success factor, which is creating a learning space. This seemed to work best where it was an open, receptive, and safe learning space that practitioners and staff could kind of step into. So some agencies deliberately used more of an appreciative inquiry approach. So the emphasis was much less on fault finding or assigning blame or attributing blame, but instead was recognizing and appreciating efforts made and results achieved. So at least 3 NGO exercises paid a lot of attention to capturing and celebrating success. And one question that was quite frequently asked of staff is, what are you most proud of? And it wasn't that this was at odds with identifying how improvements and change and course correction could be identified and kind of promoted, but it was a much more motivating approach and a less threatening approach for staff. The last point on this slide is engaging users early. And this one particular way of doing this was ensuring that the target audience for the real-time learning exercise was involved in identifying the key questions that were going to be asked. And for example, IFRC, the Federation, used a kind of crowdsourcing approach to generate a research and evaluation agenda with 4 Zoom learning events. DRC carried out scoping interviews with senior managers at headquarters and regional offices to identify 10 domains of learning. And there are a number of other examples of how agencies already started that consultative approach in identifying their questions for the real-time learning exercise. So moving to the next slide, these are the success factors more in the kind of implementation phase, or moving from planning to implementation, first of all, with such a huge global response, how to keep it focused. And as with good practice in evaluating humanitarian action, selecting a small number of high-level questions tended to work best. So the DEC in their real-time review had 3 high-level questions, which then could be unpacked and answered by the team carrying out the review. We, in carrying out this research, we asked people who'd done real-time learning exercises for examples of powerful questions. And I'm just going to give you a couple, share with you a couple. So first of all, one powerful question was, how can we better respond as the crisis unfolds? And that was regarded as a particularly helpful question because it was forward-looking. It was taking a longer term perspective, and it was constructive rather than, so what have we done wrong? It's like, well, how can we do better? Another question that was regarded as very useful was used by an NGO anonymously in a survey. And the question was, do you think our programs might cause harm or conflict? And that particular NGO found that the responses from partners produced some really thought-provoking insights. Next success factor was investing in interpersonal skills. And the importance of strong interpersonal and communication skills, they've long been recognized in RTEs, but they really were more important than ever during the pandemic, where so many people were working remotely, and the need to build rapport and trust remotely was key to being able to carry out a really effective learning exercise. So what were these interpersonal skills? Well, facilitation skills, so encouraging and assisting staff to reflect critically on their response and to find creative solutions to difficulties. Diplomatic skills, particularly engaging busy staff to engage busy staff and to communicate more challenging findings. Diplomatic skills are really important there. And thirdly, the ability to listen. It's even been suggested that that may be as of equal value to technical experience, was really being able to listen to staff. So moving on to the next success factor, sorry, note back to the last slide. The next success factor is ensuring safety and ethical engagement. And actually what I wanted to just draw attention to here was a critical part of telling the story of the COVID response was staff talking about their own personal experience. And talking to an independent evaluator was sometimes the first time that staff had a moment to pause and to really describe the experience, the pressure, the stress that they'd gone through. And sometimes that could be a very emotional experience. So there's a good practice example in the paper about how interviewers carrying out a real-time learning exercise were actually trained to recognize trauma and to respond empathetically, but also knowing what referral mechanisms existed for staff who perhaps had reached a sort of breaking point and needed to have access to kind of other services, whether it's counselling services or other welfare services. Moving on, including diverse perspectives. These real-time learning exercises were often particularly important in a context where travel was so limited and mobility was so constrained. For instance, to make sure that the voices and experiences of frontline program staff were really heard, particularly by senior management. Facilitating shared learning. Quite a few interesting methods have been pioneered during these real-time learning exercises. And these would range from some really simple 1 hour mini workshops, perhaps in a senior management meeting. And actually, I could share my own experience. I've just literally come back from evaluating UNHCR's work in Sudan. And again, staff were highly pressurized with very, very heavy workloads. And it was amazing with a very well facilitated learning exercise, what you could do at the end of a management meeting in a 1 hour facilitated learning process. But but we also had examples, for example, of World Vision, for instance, that ran full day workshops, again, quite structured, using very creative methods to really facilitate staff to learn as they reflected on their response. Building learning into the process. So as I mentioned before, the process is often more important, if not always more important, than the final report in these real-time learning exercises. And perhaps I think it makes us ask the question, have we become too fixated on the final report in more traditional evaluations? What other mechanisms can we use? So Oxfam, for instance, they have a day of reflection after their data has been collected in a real-time review. Findings are shared, reviewed, validated, action plans are jointly developed, and that process was followed, albeit remotely, for their real-time review of the COVID-19 response. So, in conclusion, I think there's a lot of evidence of some really interesting, creative, innovative adaptations during the pandemic. This invitation to think outside the box. And I think it really does force us as evaluators and evaluation managers to ask, have we become a bit too set in our ways? Are we too driven by protocol that we forget to ask sometimes if we're really meeting the learning needs of the staff, the organizations that we're serving? And I think being truly utilization focused means continually asking, not just at the beginning, but throughout the process, what an organization and its staff needs from the exercise, and being adaptive and flexible in our approach to meet that need. Thanks very much.
Great, thank you, Margie. So now that we've heard a little bit more about real-time learning and many specific examples also of how organizations approached it, we are going to go now to a panel, and we're going to hear some specific examples of how organizations have adapted evaluation practices to the disruption of COVID-19. So our panelists today include Hicham Daoudi. So he's an evaluation advisor at UNFPA. We also have Jane Mwangi, who is a senior evaluation specialist at UNICEF. And then we also have Margie, who will be sharing some insights based on her earlier work with ALNAP on our peer-to-peer learning workshops held earlier this year, specifically on M&E and COVID-19. Next slide, please. So in the panel today, we're going to focus really on two key issues. So the first is, how did evaluation functions, how were they used and how were they repurposed during COVID-19? And the second key question is how the planning, management, and conduct of evaluations had to change due to the disruption of COVID. Okay, next slide. So we're going to ask the first question now to Hicham. So we're going to go to Hicham of UNFPA. Hicham, how did COVID affect UNFPA's approach to evaluation? Can you tell us a little bit more around how you responded to it?
Yes, thank you, Susanna, and hello, everyone. Yes, so this question on how we were affected, how the UNFPA Evaluation Office was affected by the COVID-19 pandemic. I would say that the first effect, it raised a very blunt question, I would say, to us evaluation practitioners, which was really about the relevance of evaluation in a time of COVID. I mean, the first question that we discussed at one of the early weekly meetings that we have at the evaluation office was, what should we do? Is it an option not to conduct evaluations or to pause rather the evaluations? And it may sound as a rhetorical question, of course, because there's no point in stopping evaluations. But nevertheless, even if we evaluators are convinced of the importance and of the crucial need of evaluations, we still needed to persuade and convince our interlocutors, be they the decision makers or program colleagues, of the value, the actual value proposition of evaluation. And to do so, we had to prove that we could remain relevant and useful to the organization at a time when priority was given to legitimately, of course, to the response, to the actual response to the reallocation and repurposing of programming, reallocation of resources when we speak of evaluation conducted at decentralized levels. That was really I would say what triggered the reflection. And in order to ensure that we would remain relevant and useful, this led us to revisit the evaluation plans. And one of the first key adaptive measures that we took at the evaluation office was to assess the level of priority of the planned evaluations. And this led us to sometimes readjust, postpone some of the evaluations that we had initially planned, advanced some. For example, there was a high pressure to conduct as soon as possible an evaluation of the UNFPA response to COVID-19. And there we had to back a little bit and to say that to conduct such an evaluation and to make it meaningful, there were steps to be carried out before, and I will tell you more about that later. So the first thing was really to reassess the level of priorities, to also in order to respond to the immediate needs, urgent needs of the organization, which were very much on the learning side. And on this, I very much confirm what Margie presented us with, that in the balance between accountability and learning that any evaluation incorporates, clearly at the time of COVID, the emphasis should be placed on learning, and our interlocutors were really keen on getting rapid lessons on the way UNFPA was responding to COVID. And in order to do that, we had to broaden the variety of exercises beyond our traditional evaluations. So we expanded the number of meta-analyses. We also strengthened developmental approaches, developmental evaluations, formative evaluations, which are in both cases more adapted to a period when change is unfolding and we need quick learning, but also conducting more evaluative assessments, evaluability assessments, which should lay the groundwork for future full-fledged evaluations. So that's the menu of evaluations that was expanded. And within the evaluations themselves, we also initiated a series of innovations which very much resonate again with what Margie presented. So beside the final report of an evaluation, we felt that it was urgent to create more byproducts or side products to the evaluation. And one example I can give is in a recently launched evaluation of the engagement of UNFPA in the UN reform. We decided to develop 3 learning papers, or I should say action papers, focusing on themes which are of direct strategic importance for UNFPA, and within which we would be able to assess, for example, the response to COVID as a test of the UN reform itself. So, and those papers, which are, I would say, conducted in a rapid manner, and with less in-depth analysis than in a full-fledged evaluation, nevertheless are conducted with rigor, and we've just adapted the way we collected data. At the decentralized level, what we did, and through the development of 2 guidance notes, we helped our decentralized business units, majorly country offices which conduct country program evaluations. We helped them to focus the scope of their country program evaluations, both geographically and programmatically, to also adapt their timeline, specifically for the data collection phase. And to the extent possible, what we tried to do was really to adapt rather than postpone or cancel evaluations. And I must say that in this regard, we were successful, that we managed to adapt evaluations rather than canceling them, which is really the last result. And the last effect, which also is of importance, is the fact that we further explored opportunities for joint and system-wide evaluations. In this regard, COVID-19 has not initiated anything new. It's rather an acceleration of trends that were already there. UNFPA was already very much engaged in joint and system-wide evaluations, but clearly the COVID-19 pandemic has given a further push towards these joint and system-wide evaluations. And today we are at more than 50% of the evaluations contained in the UNFPA quadrennial plan, evaluation plan, which are either joint and system-wide. We are partners in the global COVID-19 evaluation coalition led by OECD. We are also a member of the management group of the interagency humanitarian evaluation on the humanitarian response to COVID-19, and we are also part of the evaluation advisory group of the system-wide evaluation on the socio-economic response to COVID-19. So this means that all the effort of jointness and system-wide evaluations has been further encouraged by the COVID-19. I will probably, I'm a bit long, so I will stop there, Susanna, and I may come back later on if need be. Thanks.
Okay, great. Thank you so much, Hicham. No, I think that really echoes with a lot of what we've heard from other organizations as well. And obviously at ALNAP, we also like to promote kind of joint evaluations and are quite involved ourselves in the Global COVID-19 Evaluation Coalition, kind of supporting the secretariat function of the OECD and in the interagency humanitarian evaluation of COVID-19. So I think it's really great to have these joined up efforts, I suppose, kind of pulling in the same direction, because there is this massive need, I think, to learn quite quickly of, did the humanitarian response to COVID really meet the needs? So now I'm going to go to Jane of UNICEF. So I'm going to ask you the same question, Jane. If you can just speak a little bit around how did COVID affect UNICEF's approach to evaluation? So Jane, over to you.
Thank you very much, Susanna. And thank also for giving me the opportunity to be part of this panel. As our executive director said at the beginning of COVID, children were the hidden victims of the COVID pandemic. And we know that, that lockdowns and school closures affected the education, mental health, and access to basic health and other services, and also elevated the risks of exploitation and abuse. So for the evaluation function, as Hicham has indicated, we had to pause and discuss and agree that we were still very much relevant and that we would still be able to, we were relevant and we were needed to provide evidence to the organization in regards to how the organization was responding to the COVID epidemic. To put this into some context, for UNICEF, and I believe also many other of the UN agencies, COVID-19 was declared a scale-up L3 global emergency. Its application was for all country offices, all regional offices, and all HQ divisions to respond collectively to the epidemic. Scale-up programming was therefore taking place in all countries, and we very much had to take this into consideration even when we were planning for all evaluative exercises. We needed to consider that, unlike in other crises, other emergencies, in this particular case, evaluative activities were going to take part, not in a few countries, but practically in all the countries that UNICEF works. And some of them, I mean, of course, are very, very different. We have countries where programming is upscale and advocacy. And then we also have countries where we program directly with partners and government. So we needed to take that into consideration as well. And then also because of this ever-changing environment, there were calls for continuous adaptation for programming. And for the evaluation function, we needed to continue to contribute to learning. We saw an urgent need for in-depth understanding of how countries were responding to this crisis to inform leadership decisions. So for us, we were proactive in terms of approaching leadership and telling them, hey, we can support you. We can undertake evaluative exercises that would be able to provide us with some of the evidence in terms of how the countries are programming and some of the challenges we are seeing. As a function, we needed to think outside the box to address critical issues. How could we adapt and repurpose the evaluation function to support programming for children? What was possible, including methodological approaches, to do during a global pandemic and lockdown? What was good enough evidence? And we just like in the case of Hicham, we also provided some technical guides to our decentralized evaluation function in terms of what we needed to do to repurpose the evaluation function, and then also what we needed to do in regards to some of the evaluative work. These guides outlined the implications of COVID crisis for the ongoing work. We had a lot of evaluations which were currently ongoing. And also, the guide also included adjustments that were required at all levels of the organization in regards to existing evaluation plans. This guidance also provided some clarity of the role of the evaluation function in regards to these challenging times in order to contribute substantially to the organization's emerging evidence needs in relation to the crisis. Evaluation plans had to be reviewed and repurposed to ensure that priority was to ensure that we were providing regular update to all the different countries in regards to how we were programming for children. Part of this guidance also suggested different approaches, just like in the case of UNFPA. We proposed evaluative evidence for continuous learning and adaptive management, iterative evaluations and rapid reviews and assessments. And then also we discussed how ongoing and scheduled evaluations would also be repurposed to ensure that we are considering COVID as a topic. And then also, just like what Hicham said, we were also thinking about joint evaluations, future evaluations, and what we needed to do to plan sufficiently for them. So overall, it was to provide to our management and to discuss with them the relevance of the evaluation function during the COVID response. And in our case, it was very encouraging because we got some very good responses and support. I'll stop there and then we can follow up with other questions. Thank you.
Great, thank you, Jane. No, I think that we're hearing some of the same points on kind of many organizations who needed to quickly put out guidance, who quickly needed to support their different evaluation offices, particularly in the decentralized systems, and then really kind of show, that the evaluation offices had a lot to offer and were able to meet those kind of senior management learning needs. And I think that echoes a lot of what we heard at ALNAP, also coming from NGOs and members of the Red Cross and Red Crescent movements. So I'm just going to go to the next question here. So if we can have the next slide. And then I want to point out, please remember, if you have any questions that you would like to put to the panelists, you can go into the upper right-hand corner and you click on the polls icon, and then you will see Q&A. So please put your questions there because we'll take some questions at the end. So my next question to the panelists, and I think I'll go to Hicham again first, is how have organizations adapted their evaluation scope, methods, and tools to mitigate the constraints and limitations stemming from the pandemic? I think you mentioned some of this, but maybe you want to go into a little bit more depth. So Hicham, over to you.
Yes, thank you, Susanna. Yes, so basically the way we adapted, I mean, the evaluation function adapted its scope, methods, and tools was really around two main in two main ways. This was done in two main ways. The first one was to adapt the scope of evaluation and all evaluations, be it the corporate ones managed at central level or decentralized, to make sure that all of them systematically addressed the COVID-19 related issues, be it in terms of context, because obviously the context in which even development activities were operating was changed, but also in terms of programmatic focus. So in both cases, this had to be well made visible in the scope of all evaluations conducted. The second way was really about adapting methods and tools, which, I mean, Margie alluded to it, very much pertain to the inability or utmost difficulty to conduct face-to-face interviews, to carry out field visits, and so this has led to encourage evaluation managers to use remote data collection methods and tools, into remote interviews, online surveys. We promoted also the use of social media and virtual meetings for the dissemination of evaluation results, as well as, in some cases, third-party monitoring and evaluation organizations on the ground and local consultants. On this point, I just want to point that in doing so, we really emphasized also the need to respect the principle of doing no harm. So there was a clear red line that outsourcing or the evaluative activities didn't mean simply outsourcing the risk associated with conducting evaluative activities in the time of COVID. So we were very clear on this. And also one of the key features of one of the, I mean, the second guidance note that I mentioned earlier that we produced was really about systematically also discussing the implications of COVID-19 in each of the in the application of each of the standard evaluation criteria. So just to give an example, when we speak of relevance, we have to include the relevance in the context of COVID-19 and with regard, be it in terms of context, but also in terms of the specific emerging needs due to the COVID-19 pandemic. And a program which may have been relevant prior to COVID-19 had to be reassessed in terms of its relevance in view of emerging needs, especially for the most affected populations. And lastly, the fact that we systematically integrated those elements in all evaluations was the first step for the evaluation that I mentioned earlier. So this would lay the groundwork and provide a solid evidence basis in view of the overall corporate evaluation to be launched on the response, on the UNFPA response to the COVID-19 that we will be launching in 2022. So those are the key elements that we put forward in adapting our methods and evaluation practices in the context of COVID. Thank you.
Great, thank you, Hicham. So I'm going to pose the same question now to Jane. So how has your organization adapted evaluation scope, methods, and tools to mitigate the constraints and limitations stemming from the pandemic? So over to you, Jane.
Thanks, Susanna. We also adapted in case for the scope, for example, and especially at the very beginning of the COVID, those initial months, given the lockdowns and also the different working modalities and the recognition that country offices were not undertaking typical exercises, for example, field monitoring, management at the different level of the organization were very much interested to have evidence for purposes of oversight and learning. And they also wanted to have evidence that was going to support them even in a rapidly evolving context. They wanted to understand how country offices were implementing their COVID plans, how needs were determined, how they were targeting for the different interventions. They wanted to know whether we were reaching the most vulnerable children with our interventions, how they were adapting to the needs of the population, the partnerships we were creating and expanding. They wanted to understand the challenges that country offices were facing so that to support interventions. They wanted to have some early learning, among others. So it was inevitable that we needed to look at some of these components earlier on in the response. And as a result, our tools were very much geared towards providing rapid evidence for management for making decisions. So our executive board and also our management encouraged the evaluation function to consider different kind of evaluative work. We were called to be agile and responsive, to draw on innovative tools and approaches that enabled the rapid generation, dissemination, and use of high quality evidence. So for us, we developed and implemented an expanded menu of evaluative products that were going to support management at different levels. We identified new evidence needs and came up with solutions to implement some of the evaluative activities necessary to support the response. And we had to work very closely with different regional offices, more than we have ever done before. And we conceived a series of all these different ad hoc exercises that you can see here on the screen, mostly virtual and flexible, use of innovative approaches such as fly on the wall, non-intrusive data collection, rapid reviews and synthesis, use of virtual data collection approaches and tools, and use of secondary data available, including monitoring data. So we had to do a lot in terms of just repurposing and changing our scope, and then also the tools and the methods that we were using. So some of these examples, I'll not go them in so much details, but the first one is a learning evaluation. And this one was managed by the evaluation office, and it was really for global managers to provide good enough evidence to inform decision makers in adapting UNICEF approach to COVID-19 response. So this was really supporting organizational learning. The second one, which is a real-time assessment of COVID response, this one was undertaken in all the 7 regions that UNICEF works, and more comprehensive data was collected in more than 50 countries. And this was to support regional offices in generating real-time learning and lessons on issues related to implementing and also the quality of UNICEF's response. And then the last one that I will talk about is really more the repurposing of ongoing and planned evaluations, and including a module for COVID. And we thought that was important. Just like what Hicham has said, some of the evaluations were going to continue, but we wanted to still ensure that they were relevant and they were also considering COVID as a topic. So this is really how we moved forward in regards to some of the work we did during the COVID.
Okay, great. No, thank you, Jane. I think one of the things that I've been so impressed by is actually how much UNICEF has done. We saw such a variety of real-time assessments and real-time evaluations, and so I think it's been really impressive. And I think a lot of what we're hearing echoes once again what we've heard from other ALNAP members as they've had to adapt. So I'm just going to go to Margie really quickly now, if you have anything to contribute in a sentence or two, and then we'll go to the next question. So yeah, Margie, I don't know if you have any reflections on that, kind of drawing from maybe a lot of the discussions we had, I guess, with NGOs and with other actors. I think it is quite similar. Yeah, so Margie, to put you on the spot, do you have any reflections? Yeah.
Thanks, Susanna. A couple of points I wanted to make. One is, when we were doing the interviews with key informants for that paper, I was just really struck how it sort of started off with evaluation functions feeling this, as Hicham was saying, it's like, how do we remain relevant? What's our role in this kind of uncharted territory? But it was the moment at which that switched to what many evaluation managers described as quite an exciting and stimulating time of, we've really got to, I keep on saying this, thinking outside the box, but we've really got to think kind of creatively. And I sort of felt in those interviews, and I was very privileged to be able to talk to so many people, but there was a real sense of kind of energy, of excitement. And that's why I come back to wondering whether we sometimes have boxed ourselves in a bit too much in evaluations, that we stopped thinking enough. And I think this really forced people to think about relevance. One thing we haven't talked about that much, but I don't know whether you want to touch upon it here or later, was the change in dependence or reliance. There was a shift away from relying on international evaluators to national evaluators. And I think that was also a really interesting shift, and hopefully a shift that will continue. But maybe you can come back to that later.
Great, thank you. No, so I think we'll cover that a little bit in the next question. So if we can maybe go to the next slide. So the next question that I have for all of you, and I guess if we can keep it fairly short, is what have we learned from evaluations in the time of COVID? And what will the evaluation new normal look like? And I suppose that would also encompass this shift to the use of more local evaluations or evaluators. I think the localization of evaluation, it kind of also echoes some of the calls that we've heard even for decolonizing evaluation. So we've talked a lot about kind of remote M&E, and there's advantages to that and there's challenges. So what do you think the new normal will look like going forward? So I'm going to go to Hicham first, if you can answer in a few sentences. Yeah.
Yes, thank you. And I'll try to be brief, more brief than needed. So yes, I would say the first thing that we've learned through this pandemic, and we are still learning, is that it is possible to manage and conduct evaluations differently than we did in the past. I think we have already some elements of tangible success of those approaches, and those, I mean, Margie mentioned one of them. I mean, the localization of, if I can use that term, the localization of the consultancy, the fact that we use remote data collection to a certain extent, because I mean, as the slide shows, there is in a way a need for return to pre-pandemic data methods, specifically, I would say, with regard to the most vulnerable, the hardest to reach populations. I mean, Margie mentioned the need to have to ensure that the voice of the hardest to reach and those furthest left behind, to make sure that their voice is heard in an evaluation. And I think they are the ones who suffered most from these remote data collection methods. Obviously, I think all organizations, we try to find ways to mitigate this difficulty and be able to access those populations. But I think there's here a real blind spot in current practices. So I think we need to keep this in mind, but at the same time benefit from what COVID-19 has brought about in terms of light touch methods, rapid assessments, etc., which, in my view, are here to enrich the practices that we had before, rather than to substitute them. And so, in terms of, I would say, instead of speaking of a return to normal, I think it would be more advisable, more desirable to hope for an enriched normal, which is the practices that we were enjoying in the past, enriched by those that we've crafted or experimented during the pandemic. So that would be my conclusion on this. Thank you.
Great, thank you so much, Hicham. And as I mentioned, yeah, we published an earlier paper kind of looking at the challenges of remote digital M&E and kind of the ethics and the gaps of that. And I think one of the conclusions is, while you can do so much with that and with third-party monitors, there are still some downsides. And so kind of, people who do not have access to the internet or to telephones. And so we are still missing some of the people, I guess, who are the furthest behind. So I'm going to just now go to Jane really quickly. So Jane, what do you think the new evaluation normal will look like? And I know that UNICEF also has quite a decentralized system, and I understood maybe you have more relationship actually with local evaluators in the regional offices or country offices. Yeah, so over to Jane, what do you think the new normal will look like? And any thoughts on this issue of localizing, or maybe it's actually further decentralizing evaluation in some cases? Yeah. Jane, sorry, I think that you're on mute. Could you unmute yourself?
Oh, sorry, I'm sorry. Yes, I was saying that I agree with Hicham that during this past year, it has been possible to undertake evaluative exercises that have provided critical evidence for our management in terms of making decisions and also pushing the COVID response forward. I'm not certain also, just like Hicham, that we'll be returning to our old pre-COVID days of undertaking evaluations. I feel that we have had a lot of lessons and experiences during this past 1 year, and some of those experiences are really rich, and it will be useful to take those ones forward. So for me, I see that the direct and indirect causal effects of the pandemic, including COVID, which will stay, it means we have to take that into consideration when we are designing our evaluations. Pandemics, global warming, and so forth will officially become cross-cutting themes in evaluations. Sometimes not necessarily undertaken as standalone evaluations, but we need to take that into consideration as we design our evaluations. Then also the new normal will involve more innovative ways of utilizing the limited evaluation resources. We likely see, and we're already seeing that even from UNICEF, less travel by international consultants and only traveling when it is deemed necessary. More data collection undertaken remotely. The new normal will also see greater reliance on technologies, which provides promising opportunities to unlock new sources of real time and facilitate more efficient and inclusive modes of information exchange. We'll see more and better use of existing data and evidence. Sometimes I don't necessarily think we mind that very well, but the new normal will mean us looking at all the evidence monitoring data that already exists. Then, of course, in terms of technology, mobile, big data, geospatial data, and so forth. Then you touched upon the issue of using national consultants. We tried that when we had our evaluations. And what was very interesting was that we could not even get good consultants in some of the countries because everybody was undertaking COVID-related evaluations. So the new normal would obviously mean greater investment in enhancing national evaluation capacities. And then also in our case at UNICEF, where we have a bigger evaluation community with regional evaluation advisors and multi-country evaluation experts, we may also be using internal resources because these are also independent from actual program implementation. Then finally, I think we also need to come up again, and you raised this point, Susanna, in regards to how do we still ensure that even when we are having this new normal, we still engage with communities, that we still talk to the relevant stakeholders who would provide us with richer and more timely data to help us in terms of analysis. And then obviously, we still need to ensure that these evaluations are still robust and of quality. So we'll need also to balance all that to ensure that at least we have good evidence that is credible and which organizations can really help us to do better and to reach each and every child in our case. Over.
You know, I think you raised that really important point of evaluation capacity development. And I suppose there's many initiatives, particularly on the development side. And I think I'm realizing on the humanitarian side, it seems like there's a little bit less. So maybe there'll be a new impetus actually in kind of investing in these national capacities and making sure that we do have like a wide pool of humanitarian evaluators in local areas to draw upon, and that we have those contacts as well. That's something maybe for us at ALNAP also to think about further. So Margie, if you can say in one sentence, I'm really sorry, because I do want to be able to take a question or two from the audience. What will the new evaluation normal look like to you? Now, you know, ALNAP did a paper series before, and one of them was kind of looking at the history of evaluation over time and how it's evolved. And then we said, you know, COVID is quite a disruptor. And so, you know, is that here to stay? And I think we were saying, yes, COVID really is a fundamental change. Something has shifted. Yeah, so do you think that that's accurate, Margie? And I think you have 30 years in the field. So do you really sense this is kind of a moment of profound change, or is it going to be kind of a passing transitory phase? Over to you, Margie.
Well, it's up to us whether we make it a moment of profound change. And I think I'm going to take two sentences, I'm afraid, Susanna. But I think it's been it's encouraged us all to pause and think about what really matters in evaluation. And I find myself often going back to a quote from Michael Quinn Patton that came out in one of his blog posts in January, where he talks about evaluation leadership, saying it requires much more than methodological knowledge and management excellence. It requires astute political judgment to navigate organizational mazes. And he talks about interpersonal skills to establish and nurture the critical relationships to utilization-focused evaluation. And I think the pandemic has made us value those much more. I really hope that continues. And the other one that I want to give as an example is actually, I think there's been lots of creative ways of communicating the findings of evaluative exercises, real-time learning exercises. So it's not necessarily waiting until the end of a lengthy process, but it's actually communicating in an ongoing way. And in both of the papers, the Learning as We Go and the Real-Time Learning paper, we have some examples there from MSF produced a one-page poster that captured some of their key results. WFP produced short lessons learned documents throughout their RTE process. In the War Child Holland example, an evaluator was producing daily blogs for staff through the process. So I think this is where we can be just so much more thoughtful, creative, reflective on how, again, we can meet the learning needs of staff who rarely have time to read lengthy reports.
Thank you. No, I think that's so important to touch upon the utilization focus of evaluations. And I suppose that's something that we hear all the time is, you know, you can invest a year and create a really 100-page reports, you know, but, you know, essentially, how do you distill that down into learning that really can be used kind of, you know, by different actors and quite quickly as well. And so I think now we're going to take the first question from the audience. And I think that it actually you know, mirrors this a little bit because it's looking at, so the question here is, are there any mechanisms for ensuring the learning sticks and is being applied in future work? Learning about the learning, so to speak. And so I guess this goes to that issue of utilization of how, are we learning how to learn? And I suppose my response on the real-time learning is that's what I found so exciting about it, is that it was actually fed so quickly back into programs. And sometimes those teams are actually embedded into the decision-making bodies. But I think I'll go maybe, I don't know if Hicham, Jane, or Margie, one of you wants to take this question. It's kind of the perennial question, I think, in evaluation questions, or, how do we know that we really are learning? Sometimes there's anecdotal evidence. I see Margie has her hand up. So let's go to you, Margie. Do you want to take on that question?
Sure. Yeah, thanks, Susanna. And I think it's a mixture of some, how do we make sure it sticks? It's a mixture of using some conventional evaluation mechanisms that we know work quite well. And this, for example, would be the management response. And it was interesting when we were looking at Oxfam's practice to see that they had at one point moved towards just producing action plans after real-time reviews, and then they reintroduced management response processes as a way of really ensuring that there was follow-up to whatever the learning was, whatever the key findings were. But what I would like to see is if we commit to and engage more in really utilization focused learning exercises. Each learning exercise is an opportunity to pick up the learning from before and say, well, did this stick? And to remind people of that learning and to make sure that the journey continues. It's not just a journey during that one-off learning exercise, but that journey continues from one learning exercise to another. So that's what I wanted to contribute. Thanks.
Okay, great. So maybe we can take one more question. So there was a question, do you think that lighter real-time learning approaches
Susanna?
are going to lead to greater uptake of recommendations? And I think we can combine that with a question on, do you think real-time learning is going to continue after COVID? So I guess my instinct would be that real-time learning works very well in complexity when something is happening and shifting very quickly. So maybe I'll go either to Jane or Margie, because I know UNICEF did some of these real-time assessments and real-time evaluations. Are you doing that, kind of planning them for the future as well? Maybe Jane, and then if Margie can come in. Yeah.
Yeah, thank you very much, Susanna. For us, as you have said, we need to take real-time learning as part of our contexts, and when it is really necessary to undertake these rapid learning exercises. So in our case, yes, indeed, we'd want to continue them, but then it will not be necessarily being undertaken across the board in all the countries. It will really be in locations and in situations where we do want to learn rapidly, where we want evidence to be gathered rapidly to inform some of the key decisions. So that is really where we see the value of that particular, of that kind of learning. So for example, there are the adaptive management exercises that we undertook were found to be very useful because feedback to management to make decisions was rapid, and they needed the evidence very quickly. And as a result, that was seen to be relevant. But moving forward, we'll then really be going back to traditional ways of evaluations. But I think very much related to what Margie has indicated, not really looking at the final product, but rather how can we ensure that evaluation evidence is being disseminated throughout the evaluation process. So just not waiting for a final report for that to be disseminated.
Yeah, no, I guess that goes really to the timeliness of it. Yes, so Margie, yes or no? Do you think real-time learning is going to become more popular going forward? And then I think we'll have to close the audience Q&A there. So yeah, yes or no, Margie, I suppose.
Well, I hope so, yes. But I think there's a virtuous circle that we can create here. So where these real-time learning exercises have really served the needs of whether it's senior managers or frontline program staff or headquarters level regional offices. And I think we have heard, certainly in the work that we did feeding into the paper that's just been published, I think we were hearing how these real-time learning exercises had sort of quenched the appetite to learn. And I think the more we, as evaluators and evaluation functions, evaluation managers, the more we can be meeting those learning needs successfully, it becomes a virtuous circle where these exercises will be requested more by frontline staff, country offices, etc. So I am very hoping that'll be a yes.
Great, thank you so much, Margie. And so I see we have a number of other questions. So I'd just like to invite the audience, if we haven't gotten to your question now, we do have an ALNAP online M&E community of practice. So please go to ALNAP and join our M&E community of practice, and we would be very happy to take forward this conversation there and answer your questions. So if we can just go to the next slide, we're going to wrap up the panel now. So I just want to also tell the audience around one other piece of work that we have been doing. So at ALNAP, one of the things that we do is we look at centralizing information, and we have the largest database of humanitarian evaluations in any one single location. And so we also started a COVID-19 portal. And so we started this very early on in the COVID response. And what we've done more recently is create an evaluation specific part of this portal. And so we really want to invite everyone out there to go to this COVID-19 evaluation portal. Your evaluation should be there. So UNICEF evaluation should be there. UNFPA evaluation should be there. If your evaluation is not there, well, then what you need to do is go there and upload it. And so many actors have asked ALNAP to centralize all of these evaluation reports and learnings into one place. And so if you can please, take a few minutes and go to the ALNAP website and the portal. And we're also doing this jointly with the Global COVID-19 Evaluation Coalition. So for the first time, we're also including development evaluations, because the line between humanitarian and development in COVID is a little bit blurry. So if it's a development evaluation on COVID, you can also add it there. And then as a next step, we're working on a COVID-19 synthesis of evaluations. And so obviously, if you want your evidence to be included in that, we would encourage you to add it to the portal, and we hope that it'll really be a key resource for the sector. Now, without further ado, we're going to go to the closing remarks. So I'm very happy to say that we have Marco Segone, who is joining us today. So many people in the evaluation world know Marco. So some might say that he doesn't need that much of an introduction, but Marco is the Director of Evaluation at UNFPA. He also previously served as Director of Evaluation at UN Women, and he was the Chair of the UN Evaluation Group, among many other affiliations that he's had. As I've said, he's quite well known in evaluation circles around the world and is seen as a key thought leader. So Marco, I'm going to go hand the floor over to you for a few closing remarks as a leader, I would say, in the evaluation space. Marco, over to you.
Thank you very much, Susanna, and hi, everybody. So when the COVID-19 pandemic broke out, we feared that it could constitute a severe setback for evaluation. Well, we have just heard from this discussion today that this has not been the case. On the contrary. So as a closing remarks, I would like to offer 5 overall reflections. First, I think that we should move from thinking and talking about a COVID crisis to a COVID era. Because, the COVID crisis, the idea of the COVID crisis is that it will be something that will be over in 1 or 2 years. And hopefully that will happen for the health aspect of the COVID crisis. But in reality, the implications, the socioeconomic implications will continue to impact the life of people for decades to come. Disrupting and revolutionizing, for example, the international relationships and the global power relations, the global trade, the impact on poverty, macroeconomic policies, etc. Therefore, the implication is, we talk a lot about will go back to the normal before the COVID, also when it comes to evaluation. Well, if we see COVID as an era, so that is truly transformational, then the reality and the practice will not be as the pre-COVID, because COVID is accelerating existing trends, even in evaluation. So when it comes to evaluation in particular, the second reflection is that even before COVID, there was a tendency to move from what we may call extremely robust academical summative evaluation reports to more formative developmental evaluations, real-time evaluations for adaptations reports. So that was somehow a trend, a tendency that was happening before COVID, but definitely COVID has accelerated tremendously this trend. And therefore, in the future, the new normal, I think that we will have to better balance these two approaches. As we heard also from our panelists, we will need a richer menu of evaluations that are responsive to the context, to the evolving context. And therefore, we will need to better integrate different approaches, moving towards flexible and hybrid approaches. The third reflection is that, as evaluation practitioners, we should also move out from this dichotomy, humanitarian evaluations and development evaluations. And we should really think about a humanitarian development evaluation nexus, because COVID just demonstrates us that, there can be any humanitarian situation in any country, regardless if it's in a high-income country, a very powerful country, a very big country, etc. So I think that also when it comes to evaluation, we should try really to bring together the experience and the practice from the humanitarian evaluation perspective that mainly is about real-time evaluation, and now we just learn about real-time learning, with also the development evaluation perspective that is more about adaptive management. It's more about being flexible, agile, and innovative, such as, for example, in developmental evaluation. Because, and that's my fourth reflection, we should move from accountability for results to accountability for learning and adapting for results. That means moving from the very rigid and static hierarchical result framework to be accountable, to adapt, to be able to deliver results for the people, for the life of people. And so this brings me to the fifth consideration, that we should move from the rigid business as usual evaluations towards adaptive and responsive evaluations. Adaptive and responsive both in terms of approaches and methods, but also adaptive and responsive in terms of designing and conceptualizing our evaluations to be able to provide evidence to decision makers so that they can be adaptive and responsive. So that means that we should move from the focus on the evaluation reports to the evaluation process, ensuring real-time learning processes for adaptations throughout the evaluation process. Therefore, we should make sure not to forget the lessons that COVID-19 has taught us and is still teaching us the hard way. To remain relevant and useful, evaluation functions will need to continuously prove their ability to adapt to the new context and to address new needs. In other words, COVID-19 invites us to embrace and steer change rather than submit to it. So thanks a lot, ALNAP, for organizing this very interesting panel, and thanks a lot to the panelists and the participants. Thank you. Over to you.
Great, thank you so much. So I think with that, we are going to wrap up this session. But once again, please do go to ALNAP's M&E website. You will find all of the papers, including our most recent real-time learning paper. And if you're not already a member of the M&E community of practice, you can also join our online M&E community of practice. And we would love to follow up with you further after this event. So thank you so much. And thank you once again to all of our speakers and panelists. And with that, I just invite you to go to the closing session now of the ALNAP annual meeting. Thank you.